Thank you so much for inviting me to be part of today's Prostate Cancer Awareness Day. I'm really pleased to be with you, even if it's electronically. I wish I could be with you in person because, as I think many of you know, this is a personal cause for me. This disease took my father's life, but I was very lucky to be able to beat it 10 years ago. I want everybody who suffers this disease to learn the special feeling of being cancer-free. So much is going on in Washington now, including the reintroduction of legislation to help all of us in the fight against prostate cancer, that it was just impossible to get away. And I hope you understand that. But I know you've got my good friends, President Terry Murray and Speaker of the House Bobby DeLeo there with you. And I thank them particularly for joining the fight against this disease and being so instrumental in making Massachusetts a model of national leadership in recognizing prostate cancer as a public health priority. I also want to thank the Massachusetts Legislature, the Boston City Council, the American Cancer Society, and the AdmeTech Foundation for all playing an important role in this event, and especially in helping to increase public education about prostate cancer with their Where Is Our Mammogram program. A special thank you also to the AdmeTech folks for organizing this event. Through federal funding, they've been able to lead, design, and support groundbreaking research in advanced imaging for prostate cancer. This is a great example of federal research dollars at work that will improve early detection while also reducing unnecessary procedures. One of the things that I'm working on here in Washington is reintroducing the PRIME Act with Senator Boxer. This legislation is going to help us develop new advanced imaging technologies in order to detect and diagnose prostate cancer. It'll also finance support awareness programs with a focus on men at the highest risk, particularly African American men and those with a family history of prostate cancer. Just 2 weeks ago, I introduced a resolution in the Senate to bring attention to the issue of prostate cancer, how it disproportionately affects African Americans, and the need for additional federal investment in prostate cancer research, education, and awareness. I did it because awareness and education of this disease is really half the battle. It's critical because prostate cancer is the most common cancer in men. Every year, more than 200,000 men are diagnosed with prostate cancer, including 4,000 of them in Massachusetts. And every year, more than 25,000 men sadly die from it. And 156 of those are our fellow citizens in Massachusetts. Prostate cancer is an epidemic. It kills every 16 minutes. When you catch it early, as I was lucky to do, survival rates are nearly 100%. But when this cancer is caught in the later stages, survival rates drop precipitously to only 28%. So we know prostate cancer is a silent killer that robs us of too many fathers, brothers, and sons, and it just doesn't have to be that way. We need to stay focused on the research, and we need to arm Americans with all of the tools to be able to prevent, detect, cure, and treat this disease. I've been through the battle against prostate cancer, and I understand exactly what it puts everybody through, the diagnosis of the strain initially, and all the loved ones who get pulled into it. I also know the importance of being able to make informed decisions with the help of your doctor and having access to quality medical care. That's why I strongly support the Affordable Care Act and will continue to defend the right for every single American to have health care coverage just like we have in Massachusetts. I want to thank you for your advocacy today, and I want to salute the courage and determination of cancer patients and their loved ones in the long fight. Let's pledge to give these Americans a brighter tomorrow by supporting innovative cancer research that holds real promise in turning the tide against this dreaded disease. It's the right thing to do, and the time to act is now. Together, we are making a difference, and together, I believe we can win this fight. Thank you, and God bless you all.